Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. Give me a call, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied, and you've come up with the same old, same old. You know, nothing that really works, and you're still suffering with the same old, same old. Well, here's an opportunity. Let's talk about it. Let's see if we can find a way without drugs, without surgery, you know, the way your body's supposed to work at things naturally. And it has all the mechanisms it ever needs. It has every nutrient, every medication, everything that your body needs to have to heal virtually everything. What it doesn't need is an interference. All the stuff that you've been doing, and we've talked about it the last couple of weeks, kind of set you up for this program, in that you've been out there doing all the nasties, the sugars and sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives. You haven't been working out. You've been staying up too late. You're not getting any sleep. The weather's been kind of miserable, as it is today. It's raining outside. It's pretty ugly. Matter of fact, be very careful today. As an aside, you know, there's accidents all over the Beltway, all over the metropolitan area, so be careful, and, you know, go slowly. Be cautious of the other guy out there who may not be thinking. But we're going to answer your questions here. And even though that it's kind of gloomy outside, it's sunshine here in the studio, because we're going to turn a new light on the subject for you. 888-630-9625. We're going to touch on a subject today that affects about 20% of the population directly, and there's a whole bunch of other folks out there, probably another 50% of you, that are headed that way over a period of time, but it either doesn't catch you, or you're being treated for something else, or you don't understand what the mechanisms, you know, that are involved, and your doctor's giving you different meds so you don't feel it. What am I talking about? We're talking about arthritic conditions. Many authors, and this is something that starts affecting people at about age 30 and goes well beyond that, obviously, into older age. But we're talking about over 20% of Americans suffer from some form, and this is direct suffering, of some form of arthritic condition. Medicine generally has held that arthritic conditions, particularly things like rheumatoid, come from an autoimmune attack on the joint spaces, while degenerative changes like osteoarthritis are wear and tear. But, you know, if you look up arthritis, you're going to see that there's like a whole bunch of other types of conditions. You have gouty arthritis, you can have psoriatic arthritis, and there's some commonality among all of them, and we're going to talk about that. And you're going to hear some of the tags I put on there repetitively over time. What's that? Inflammatory processes. Autoimmune is an inflammatory process that's gotten out of control. Interesting article came out of one of the major universities, Stanford University, that demonstrated that the typical thought process of autoimmune attack on the joint spaces and wear and tear was really not true. And here's the deal. It turns out that degenerative, what we call degenerative osteoarthritis, is accompanied by the same type of pathological process, pro-inflammatory. Remember I said we're going to get back to that inflammatory reaction that's involved in rheumatoid arthritis or autoimmune response, or an inflammatory process that's out of control. So here's the deal. We're going to talk about what their findings were, and we're going to relate it to discogenic pain and different types of neck and low back pain that doesn't seem to go away no matter what. You know, many of you have gone to physicians, traditional allopathic physicians. Many of you have gone to osteopathic physicians and chiropractors and acupuncturists and so forth. And, obviously I'm throwing my approach into that as well. But you get better in many situations, but you never get fully better. And there's two reasons for that. One, either the physician that you've gone to really doesn't understand the entirety, the complete complex of this thing, or that you, as a participant in your own health, either were unwilling or were given all the information, dietary changes and lifestyle changes and things that predisposed you, if you will, to the problem. And we want to talk about that today. So we're going to talk a little bit about the drugs, but we're just going to touch upon that because most of the drugs that they're giving you to take are deadly. The steroidals, the non-steroidals, the aspirin, the NSAIDs. There's a lot of biological agents that they're using now to inject into the joint spaces, which, in my opinion, you have to be very, very careful with. But we need to understand what happens and how the body ultimately presents itself at a place where these conditions, these degenerative arthritic conditions, begin to present their ugly head. We have to look at the joint itself and understand that it's made up of many different factors. And when we look at joint spaces, we know that there's cartilage and then there's soft proteolytic type of substances that are within that hard substance as well. And then we have this soft toothpaste that's the nucleus of the joint. Now, what does this have to do with autoimmune reactions? What does this have to do with other conditions that we're setting ourselves up to? Well, when we look at the entire process of the body's replenishing things, we understand that inflammation is a necessary component. It's one that the body needs to restore function. What's not normal is when the inflammatory reaction gets out of control and it starts eating you. So who's predisposed? Well, anybody, about 60% of our population is predisposed to this. Why is that? How come? It's because of lifestyle, my friends. It's the things that we begin to put into our dietary patterns. It's important for all of us to understand that diet can directly increase or decrease inflammatory reaction within the body. Things that you breathe in, environmental stimulations, all of those things. The average American's diet contains approximately 60% of its total calories from things like sugar and flour and refined oils and so forth. Remember I said that the average consumption of every American relative just sugar, how much sugar, sweet stuff you get in your mouth, is about 170 plus pounds per year. Think about it. It's 170 pounds of sugar per year that each one of us are getting. I don't get a lot of sugar. Somebody's getting my share, somebody's getting somebody else's share, and the body goes into extreme reaction because of that. So, in other words, if we're eating diets that are high in sugar and flour and refined oils and so forth, we're setting the stage of immediate systemic inflammatory production that causes the joint spaces to be predisposed to degenerative breakdown. And that's as simple as it gets. I mean, we can get into, and we're going to touch upon the different names. I mean, we're going to talk about prostaglandins and COX-2 inhibitors and all of those things because that's part of the process. The thing of it is, remember I said 20% of the American population. That's a whole lot of folks. That's over 60 million people. And then I said about 60% of you are predisposed to this nonsense. So when you have a joint that hurts, when you have neck and shoulder pain, or you have low back pain, or you have your hips or your knees beginning to break down, there's a reason that is occurring. And traditional thought process about this, you get out and you go for a run, and you're playing tennis, or you're working at a... I say, well, it's because of your job. It's because of the kind of work that you do. No, that's the triggering mechanism of something that's been predisposed for a long period of time. So when the stage is set, so to speak, and then you have those types of conditions, but by themselves they don't cause a problem. And then, we take all these medications to decrease the pain, and we wear these supports, and we go on canes, and, we try to find shoes that help, and it's all about our lifestyle. But back pain and neck pain and joint pain by itself is one of the most prominent go-to-the-doctor symptoms that exists, period, across the board. It is a multi-billion-dollar a year industry, and we'll get started on that type of thing. But let me tell you about where spinal pain comes from. It's 40% from those little cushions in your disc, but it's not because those disc spaces begin to, on their own, suddenly pick you out and decide to break down. It's because you have caused the nutrient replenishing mechanism that makes them stronger and better to be less capable of doing those things. So when we look at the biology of any joint, no matter what it is, whether it's in your fingers, your wrists, your knees, your hips, your neck, your back, any of those things, when we look at that physiology, we look at the center of the joint space, and we look at the outside container. There's a hard cartilage that makes up all joint spaces. No, if you pick the joint, it doesn't make any difference. All this applies straight across the board. So that outside cartilage is something called collagen. We go try to figure, well, we need collagen for our face so our face looks better. Well, if we don't have the support mechanism, meaning the nutrient bases that can absorb easily from the intestinal tract into the body to replace all these things, then guess what happens? You break down and you look ugly. I mean, across the board, it's probably the same type of thing. But we have to understand that it's a predisposition. It's something that in most situations is a result of what we do. You go out and you catch a softball, and you didn't get your finger out of the way, and the softball hits you on the end of your finger. And all of a sudden, now, over a period of time, you can't bend that finger anymore. Why is that? Well, you hurt the joint, you sprained it, but it should heal unless you broke something. And if you didn't break something, then the normal reparative restorative process takes place, and then pretty soon, if the muscles are working properly and you get all the swelling out, then the joint should work, because you're going to go into inflammation. Inflammation causes repair mechanism to kick in, and then your body quiets it down. But the thing is that we have a joint that's already predisposed. It's already irritated. It's already inflamed. So we have this chronic inflammatory reaction that's underneath there that is due to lifestyle and dietary choices that we've talked about already. So we have to make sure that we're very aware of this. And we're going to get into what happens with this, but more importantly, I'm going to teach you what to do with this and how to change it. Because coming up in 2014, we have to take control of our own health. We have to be the primary drivers. Remember my book, Ageless Health, Health is a Do-It-Yourself Program? That book lays out how you can make a decision and take control of your life and get rid of the predisposing mental states that some of us could get ourselves into and say we can't, or, I don't want to give this up. I'd rather die. I've had patients tell me that they'd rather die than give up whatever it is, and you can put the tag on it. I'd rather die than give up my cigar or my cigarettes or my donuts or whatever that happens, to be for you. That's craziness. I mean, life is so beautiful and so important and so creative, and should be for all of us, to have that attitude. Something in your brain, you're getting a need, a feedback loop from that. And what I mean, there's things that we want to have predictability. Well, when we have a cigarette, we're breathing, we're sucking on that cigarette, but the nicotine and the tars and the residues and so forth are getting into our body, and they're causing an effect, and that immediacy is giving us some relief of something. Maybe it's just an emotional release of having something in our fingers and drawing in and breathing deeper. Maybe it's, when you eat that sugar-covered donut and it gives you a sugar high and you just feel like, life is good, but all of a sudden on the other side of it you crash. That's giving you a predictable situation, so you go for another sugar. And maybe when you have that glass of whatever distilled spirits that you have every night, or 2 or 3, because you can't relax, because you're not getting in the gym, because you're not going for a walk, because you forget that there's some really good music that you could be listening to. One of those things, in combination of those things, are the underlying predispositions that you have subsequent to all this stuff coming about. When we come back from the break, we're going to talk about the degenerative mechanisms. We're going to answer some of your phone calls because you're already starting to call. I won't ignore you. Give us a call at 888-630-9625, 888-630-9625. And let's get into this a little bit, and let's handle your particular situation, the medications that you may be on, and show you what you can do differently. Don't go away. This is Dr. Tom Roselle.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio on this rainy Washington day, but give us a call anyway, 888-630-9625, 888-630-9625. Love to talk to you on any subject. We have several phone calls, and I'd like to catch up because some of you have been waiting, but we're going to get back into talking about degenerative arthritic conditions, whether they're your fingers, your joints of your knees, your hips, your back, whatever it is. It's common. It's affecting 20% of you, and there's another 60% of you out there that are predisposed to all this nonsense, and it can be a very crippling type of condition. But let's go to the phones. Charles, thank you for calling, and thank you for holding. How can I help you, sir?
Yes, I have a relative whose eyes are tearing excessively and constantly has to use a tissue, and I was wondering if there's anything can be done for that.
Well, the problem is that it can come from so many different things. Watery eyes simply means that, your tear ducts, your lacrimal glands are kicking in and they're washing the eyes out and they're trying to protect the cornea, that outside layer that allows you to be able to see. If you lose your cornea, you go blind. But it can be an infection, it can be an allergy, it can be a tearing, a constant irritation. It can be an autoimmune problem. It can be an inflammatory condition. There are things that affect adrenal function that will affect the eyes. Lupus and Sjogren's are two of them. So you have to identify the condition. So if you have a dry eye, and that means the cornea is dry, the lacrimal glands are going to tear more to try to protect it. One of the things that you do is you can use just natural tears, which is a physiological saline, and you can keep them washed out. But more importantly, you have to find out what the underlying process is that's causing it. But things like omega fatty acids, fish oils and flax oil and borage and so forth are the things that we use with our patients if they test for them and if they have an autoimmune reaction such as the ones that we talked about. So you have to rule out multiple things. You got to see what the dietary patterns are. It can be a dietary situation where somebody's not eating, what they should be, so they're allergic to it, so their eyes are constantly red or they're injected. So it's not a simple answer, but it's one that can be fixed. It's just that the why is that has to be identified. But I would start with simply, is this friend, by the way, is male or female?
Male.
Male. How old?
92.
Okay, so I would try at that point, I would look at vitamin D, and I would look at water consumption. Could be very dehydrated. I would look at the fatty acids that we talked about. Borage, flax, fish oils, but particularly flax and borage oil are the ones that we would supplement. And I would start with that and the vitamin D and make sure that they're getting adequate amounts of just plain old water in their diet, that all by itself may solve the problem. I hope that helps somewhat. I appreciate your phone call, Charles. Thank you very much. We're talking about things like dry eyes that are consistent with the subject that we're talking about. The inflammatory pathways can affect everything across the board. And it's another caller that's up on the board. I'm going to take that before the break because it's another process. But we're here at 888-630-9625. Kim, how can I help you? Thank you for calling.
Yes. Good morning.
Good morning.
Yes. I was born with eczema skin, and since I moved here, I developed allergy, and I've been taking medication. It's called, before it was prescription, have to be prescription, Allegra, and now I can buy it over the counter. However, for the skin, I use some kind of prescription lotion, and it's very dangerous if I keep using it for a long time because
Kim, let me kind of interrupt you because what I want to talk to you about is simply this. Now, the eczema, the skin problem that you've had since you were born?
Yes.
Okay. How old are you now?
I am 19.
Okay. So here's what the situation is. Any kind of predisposition, genetic predisposition, or subsequent problems because of your mother's health when you were born, the fatty acids that she may not have been getting properly, the diet that she was on, all those things have to be taken into consideration. But any skin condition is a result of a couple different things. It can be a result of the intestinal tract not working the way it's supposed to. It can be a result of the liver not metabolizing properly. The skin is the largest organ of elimination that's in the body. So you're going to see things on the skin as a result of things that happen inside. Any inflammatory process that goes a long period of time always invariably shows up on the skin. So you have to find out what's inside the body, what organ systems are working or not working properly. It's just not a matter of taking medications, Allegra or anything else, or taking allergy shots. If your immune system isn't strong enough, the allergy shots aren't going to work. So there's more that should be done. We're coming up to the break. I can't answer it fully, but if you get a hold of me at rosellecare.com, I'll give you more information. But this is something that can be modified. It can be eliminated. Coming up to a break. Unfortunately, we can't be as thorough as we'd like to. We'll be right back after these important messages and the news. This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle Web Store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle Web Store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio on this rainy Washington day, but we're here for you. 888-630-9625. That's 888-630-9625. Looking forward to a exciting 2014. We have all kinds of things happening in our office. I want to encourage you to go to our website at rosellecare.com. That's ROSELLECARE.com. And check out all the in-house presentations. I think we have about 4 or 5 of them listed already. The rest of them will be up probably this next week. But additionally, we have all of the old in-house continuing education programs that are there that are really inexpensive for your listening. All the 2-hour presentations, I think you can get them for like $3 or something of that nature. Our charge is simply to cover our costs on it, not to make any money. We want you to have those as a constant reference, a constant library, so you can go back and really learn what you can do to help yourself. And don't forget, Ageless Health. Health is a do-it-yourself program. My book is one that you should have in your library because it gives you a step-by-step guide, but from the mental, structural, and biochemical pathways that will allow you to put together step-by-step a change, and that's what you need to do coming up in 2014. You need to be responsible for your health because, trust me, with all the shifting that's going on in the healthcare arena today, if you don't take control, you're in trouble. But that may be the side event of a good thing. That might be, the end product that is going to force our hand to really make us aware, to step up to the plate, to take responsibility for our own lives, our own health, because you don't need the drugs, you don't need the surgery, you don't need, other than traumatic situations, other than genetic predispositions that show their ugly head, and then you can reverse 80% of those. If you really understood the mechanism of what takes place and you were willing emotionally to take the steps that you needed to take to change things for yourself, there's so much that you can do. And at any time that any of my doctors or myself can help you in any way, you can get a hold of us at rosellecare.com or call the office, 703-698-7117. Say, hey, listen, I need some help. I need to talk to somebody. And if we can lead you in the right direction, we'll suggest to you that you do X, Y, and Z, or even come in and say hello to us and see what we can do to help you. We're talking a little bit about arthritic degenerative changes and kind of opening the light to what really is and what really isn't. Early on in the program today, we talked about a group of scientists, 25 of them actually, out of the University of Stanford University out in California, that did this whole research project on autoimmune system. And by the way, if you'd like to read this thing, it came out of a magazine that sometimes I agree with, sometimes I don't, Life Extensions magazine. And I'm constantly reading these things because I have to keep up with what you're reading. I have to understand it, because when you come in and you ask me these questions, I don't want to look kind of foolish, like I didn't read it, I didn't know about it. Actually, I knew about it, but they're finally coming around to my way of thinking. So what they're saying is that all this stuff that we believed before on wear and tear joint spaces, and that's what caused arthritis, or trauma, that's what caused arthritis, it really isn't so. What the problem is an autoimmune response that is the key in causing joint space degeneration, whether it's in the hip, whether it's in the spine, whether it's in the knees, whether it's in the shoulder, whether it's in your fingers, your wrists, doesn't make any difference. It's an underlying inflammatory process that damages the soft tissue, makes it predisposed, destroys or alters the natural lubrication of the joint spaces. Subsequently, what you end up with is a really raging problem. Now, there's only 3 things that cause anything. Remember, sugars, which is biochemical side of the triangle. And the reason I said sugars is because all of you had a whole bunch of that recently. But structural, chemical, emotional pathways. You can be injured, that's the structure, and constant chronic pain causes inflammatory reactions within the body. Biochemistries, things that we've talked about, all those things can set you up. And the third is stress, emotional, how you handle your brain, how you work, how you look through things. Are you constantly jacked up about something, or can you relax and really settle down? Do you listen to good music, or are you constantly in a state of fret? Are you sleeping the way you should sleep at nighttime? There's ways of handling all those things. But if those things are predisposed in and of themselves, guess what happens? Any other insult from the environment will cause an issue. So we need to kind of pick our way through it and kind of take one layer off and ask the question, why is that? What am I doing in my lifestyle that kind of, needs to be changed? So we're going to talk about these predispositions as we go through. We're going to talk a little bit about the breakdown. They had a really interesting piece of commentary in this article as well, and I started laughing because it had to do with chicken soup. And they said that they found that people who ate chicken soup, they saw a decrease of an inflammatory response within the body, and that it wasn't the vegetables in the soup, but it was actually something within the chicken broth itself that causes this anti-inflammatory. So see, Jewish penicillin and Italian chicken soup are the best things that you can put in your body. Just make sure that they're all natural. Let's go to the phones. Al, how can I help you? Thank you for calling, sir.
Oh, thank you. Yes, sir. I have a discoloring of both feet, from the ankles to the feet, and I am experiencing, when I wear a shoe in my left foot, pain, irritation from the shoe. So I went to my primary care physician, who diagnosed this as a circulation problem, referred me to a vascular specialist who said that there was no vascular problem, I shouldn't be concerned about the discoloring, and that the pain when I wear a shoe is not a vascular problem. So I then went to a podiatrist who gave x-rays and found no structural damage, gave me a cortisone shot, which did nothing.
Great. No, it won't. It just make it worse.
Yeah, then I went to a orthopedic guy who said he don't know what it is, and he can't help me. And that's now recently, the last week or so, I've been waking up at night with severe pain from my left foot, where the irritation usually is, right through the top of my left foot.
Okay, let me ask you a couple quick questions. First of all, how old are you?
74.
Okay, when did the discoloration start in the feet? How long?
It's been more than a year.
Okay, and is it the entire foot or just along one area of the foot?
No, the entire top of the foot.
And it's both feet?
The discoloring, yes, but the pain only in the left foot.
Okay, so there's several things that you have to rule out. Anytime you have discoloration of the foot, you immediately start thinking of two things, either vascular or lymphatic. Then after that, you start thinking about if, you have to rule out kind of contact reactions and so forth, something that you've been putting on your feet that weren't there before, or some pressure patterns, or you changed your shoes or anything of that nature. The problem is that that's not what I'm getting out of it, and I don't have a lot of time to dig into it. But here's the situation. Unfortunately, many physicians miss the obvious. And when you have the entire foot, the top of the foot, irritated like that, then you start looking at what we call dermatomal patterns, and that's where the nerves go, and you get sensory areas. The sensory beds have to be tested, and they can be tested in the office very quickly. You have to test the nerves from the spine, from the back. You have to check those out as well. Are they being irritated? The ones that cause those skin areas to be able to feel, or the muscles to be able to work, and so forth. Is there any swelling, even minor swelling? And you only can do that by being very, very specific and testing the skin and testing the tissue and looking at the synovial membranes and so forth. And you can do that. There's a test that we use in the office that's called thermographic imaging, or thermal imaging. And what we do is we look at the heat differentials in different parts of the body, and it's non-invasive. It does it with a thermogram, and then we send it out. We have those read, and that can tell us if there's a vascular impairment, a blood supply impairment, if there's an inflammatory response based on what we're talking about right now. All those things can happen, but you can have the entire foot involved, even though the top is the only thing that's being discolored. I'm not sure I'm comfortable with what you've been told so far. I think there's more that needs to be explored here, and they're just kind of tossing it off the side, not to worry about it. Are you on any medications at all?
No.
Okay, so your blood pressure is what? Do you know what it usually runs?
140 over 70.
Okay, so your blood pressure is in great shape. Have you taken any medications recently, meaning within the last year and a half to 2 years? Like were you on antibiotics for a long period of time? Were you taking any steroids for an extended period of time, or anything like of that nature?
The only thing was a prostate, enlarged prostate, I took a Prozocin 1 milligram for a while, but I don't.
You don't take that anymore?
No.
Are you a smoker of any kind?
No.
Okay. The first thing that I would do is I would get a thermogram of your feet to rule out whether or not this is a problem. If you can call thermography centers of Fairfax, you can make an appointment with them. They rent out of our office. You can do that. But I would extend it. I'm hedging a little bit simply because I'm not comfortable with what your doctors have told you. I think there's something else there neurologically and vascularly that are coupled that are causing this thing, not knowing anything else. So that has to be looked at. But Al, please, if we can help you in any way, give me a call. Love to have you, consult with any of my doctors. 888-630-9625. Sarah, how can I help you?
Oh, thank you. My knee snaps, and it's very painful when I turn over in bed. It's my right knee, and if I turn over on my right side, I'm getting back. I think my whole knee is going to break in half.
Sarah, when did that start?
A few months ago. And I've gone to an orthopedic doctor, and he also wanted to give me a cortisone shot.
Of course.
I refused. And I refused it.
Good girl.
And that was made to feel very guilty about that.
That's what they do.
Right. And nothing really happened.
Okay,
I just left the office.
Okay, so let me tell you, since there's no history of injury or anything of that nature,
none.
You have to look at the knee mechanism itself. In my business, what we do is we look at the relationship of the different muscles of any part of the body as they relate to other systems. We know that every muscle has an inside organ system that it communicates with by way of the nervous system. The spine has 31 pairs of nerve roots. They come out, they divide. One branch goes to muscle, one branch goes to an organ system. So you have this constant communication that's going on. So often, the thigh muscle, for example, has to do with small intestine. So if the intestinal tract isn't working the way it's supposed to, and not just because it's giving you pain or anything else, but there's...
I do have colitis.
Okay, well, that gives you part of it. The back of the leg is the hamstring, and the side of the leg, the iliotibial band, relate to the colon, and the quadricep muscle relates to the intestinal tract. So if those guys aren't working, then the muscles begin to misfire. And when they misfire, you're going to get an imbalance in the joint space, and then when you stress it, whether you're in a position of sleeping or you're walking up a staircase or whatever, you're going to feel it catch, you're going to feel it snap. And what you're doing is you're just getting muscle misfiring and you're feeling the ligament snap. Those things, once they're identified, and the only way they're going to be identified is through kind of the work that we do or somebody that does our work, that can be fixed. But you're going to have to make some changes, and you're going to have have it treated as well. Love to talk to you. I think this is a very fixable situation, and cortisone's not going to do it. Medication's not going to do it. Rehab's not going to do it. You got to fix the underlying problem. And my guess is it has to do with your intestinal system, particularly since you said you've got a colitis condition. Sarah, give me a call. Love to see you. Love to have one of our people take a look at you. I think you're very, very fixable, my friend.
May I ask you one more thing, please?
You're going to have to hold. We're coming up to a break, but I'll take it as soon as I come back.
Thank you.
You're welcome. 888-630-9625. We're coming up to a break, and we have to listen to some very important messages, the people that bring you Dr. Tom Roselle Live. We're here on an ongoing basis to stimulate you, to make you think, to make you question other things that have been told to you. And if I don't do anything else but do that, to make you think and make you question, then I've done my job. I've stirred up the apple cart, so to speak, and get you to do something different than what you're doing now. We'll be right back.
WMAL-FM Woodbridge, Washington. WMAL Washington. WRQX HD2, Washington.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We've been here at 888-630-9625 as we are every Sunday at 12 o'clock. Wanting your input, wanting your healthcare problems so we can fix them for you. That's more important than anything else. I try to stimulate your thought process. I try to get you to question what's been told you. Question me. Don't believe anybody, not even me. Do your own homework. Get online, open a book. But, marketing is a beautiful thing, so be very careful what you do buy into, because just because it works for one person doesn't mean it works across the board. Just because somebody says it's from natural sources doesn't mean it's good for you, because natural sources means you still could have additives and preservatives and all kinds of junk in it that is not going to do you any good. But anyway, nevertheless, Sarah, are you still there?
Yes, I am.
Okay, let's finish up real quick.
Right.
What was your second question?
All right, my primary physician has retired, and I'm having a difficult time finding one because I'm on Medicare.
Yeah, I know.
And even with referrals from other doctors giving me names, I call them up, and as soon as I mention the Medicare, they're not taking new patients.
And it's going to get worse.
And I can't find anyone.
Okay, so this is what you do. You send me a note on email, and I will send you the name of a couple people that I know that take Medicare patients.
Oh, wonderful.
Some of them do concierge medicine, but I would tell you who I would go to. Otherwise, I won't make the referral.
All right, I'm in Bethesda.
I know. I see where you're at on the call board.
Right.
Okay, so I'll do the best I can, and if it works for you, it's great. But be assured the people that I'm referring you to is someone that I would see myself.
Oh, wonderful. Thank you very
Sarah,
much.
thank you for your phone call.
All right.
Appreciate it. Good. Joe from Arlington, how can I help you, sir? Joe?
I'm thinking about something. Doctor, I perhaps wasn't as smart as some of your earlier callers and didn't tell the doctor no, but there was I had bunion surgery. There was a lot of pain, and also the inner part of my foot, on the upper part of the foot, on the left-hand side, the bones felt like they were moving around every once in a while. So, also I had a lot of inflammation, the term for it, the knuckle before the big toe.
Okay, so how long ago did you have the bunion surgery done?
Early October.
So it was October, and what's the status now, today? How does it feel?
Not good.
Okay, you still got a lot of pain on movement?
It's some pain, but the toe is up in the air. And when I finally took all the when you're sitting in the post-op, you're sitting in the chair, it's elevated, everything looks great. When I finally took all the bandages off, I also had the hammer toe with the wire through it. So I took all the bandages off and stood on it. My toe was up in the air.
Yeah.
I called the doctor immediately. She says, "Oh, that's a result of surgery."
All right. So yeah, it sounds like something that wasn't done carefully. I don't know. I haven't seen it. I was involved in the surgery. I don't know what your records are, but nevertheless, that type of surgery has very, very specific rules about it, and particularly post-op and what you do, what you shouldn't do, and the like. Bunion surgery, if it's fused, if something's not done right away, it's going to fuse completely in that abnormal position. There's some orthopedic guys that I respect, and that you need a second opinion at this point. What I want you to do is get a hold of me through my website, rosellecare.com, and I will send you 2 names of people that we refer to and at least have them evaluated and see what they say.
I'm grateful for that, Doctor.
You're welcome, Joe. I hope it turns out for you.
I appreciate that. Bye-bye now.
Sylvia, how can I help you? Very quick. We're coming up to the end of the program.
This will be brief. You mentioned thermography before. I wanted to know specifically what thermography can show about your heart, if anything.
What thermography does, it looks at heat distribution patterns. So if it shows an area of coldness where there should be warmth, shows an area of very hot vascular formation where there should be a neutral or cold area, then that sets up a warning. And the physicians who read the films, then what they do is they say further investigation necessary, and that's when you go out and you do the other testing. So it shows vascular distribution. It shows heat and cold. When it comes directly to the heart, there's different autoimmune points. There's different reflex areas that should be balanced well. And so if the physician, based on history, and they're going to take a history and they're going to submit it to the doc, if there's a history that says whatever it says, and there's an area of increased inflammatory response, particularly under the armpits or at the neck area, that would indicate a vascular impairment or increase in vascular flow. Then at that point, the physician will probably come back and say, get an ultrasound done or get another type of vascular test done. But that's how it works. Sylvia, I wish I could be a little bit more specific. I'd love to get into it. Matter of fact, we're going to do one of our programs. We're going to do just on thermographic imaging because it's a very fascinating, very interesting area. Appreciate your phone call. Thanks a lot. Coming up to the end of the program, we'll be here same time, same place next week, 12 noon. Make sure you tell your friends about us. This is Dr. Tom Roselle. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.